Hello and welcome to our video on laxative crude drugs. In this video, we will be discussing the basics of laxative crude drugs, their benefits, and potential side effects. Let's start with the basics. Laxative crude drugs are natural substances that are used to promote bowel movements and relieve constipation. These substances can come from plants, animals, or minerals. The benefits of using laxative crude drugs include relieving constipation, improving digestion, and preventing hemorrhoids. However, it is important to note that laxative crude drugs should not be used for long periods of time as they can lead to dependence and potentially harmful side effects. Laxatives are generally classified by their mode of action. We're going to talk about the classification of laxatives. Classification of laxatives. In general, laxatives can be classified into four main categories: bulk laxatives, stimulant laxatives, osmotic laxatives, and stool softeners. Bulk laxatives relieve constipation by forming soft and bulky stool, and by promoting contraction of intestinal muscles. They are generally considered the safest and are appropriate for patients with small hard stools. Nevertheless, they do not work until after a few days of consumption and patients need to take plenty of fluids. Examples of bulk laxatives include methylcellulose, wheat bran, aspigula, psyllium and sterculia. Now we will discuss about bulk laxatives and how they help relieve constipation. Constipation can be a really uncomfortable and sometimes painful experience, and bulk laxatives are one way to help alleviate these symptoms. Here are the main things you need to know about bulk laxatives. Bulk laxatives work by forming soft and bulky stool, which makes it easier for the stool to pass through the intestines. They also help promote the contraction of intestinal muscles, which can help move things along. Bulk laxatives are generally considered the safest type of laxative, and are appropriate for patients with small, hard stools. They are also a good choice for patients who want to avoid the potential side effects of other types of laxatives. However, it's important to note that bulk laxatives don't work right away. It can take a few days of consistent use before you start to see results. Additionally, patients need to make sure they are taking plenty of fluids when using bulk laxatives, as they can be dehydrating if not consumed with enough liquid. Some examples of bulk laxatives include methylcellulose, wheat bran, aspigula, psyllium, and sterculia. These can be found in various over-the-counter products, and your doctor can also recommend a specific brand or type based on your individual needs. In summary, bulk laxatives are a safe and effective option for relieving constipation. While they may take a few days to work and require plenty of fluids, they can help make bowel movements easier and more comfortable. As always, be sure to talk to your doctor before starting any new medication or treatment plan. Stimulant laxatives speed up the bowel movement by stimulating the contraction of intestinal muscles. Examples of stimulant laxatives are bisacodyl, senna, glycerol, and sodium bicarbonate. They have a more rapid onset of action, about 6 to 12 hours, than bulk laxatives, and are usually given at night to help reduce a bowel movement the following morning. Glycerol suppositories are normally used when a bowel movement is needed quickly, with onset of action of about 15 to 30 minutes. Now we will deeply discuss what they are, how they work, and some common examples of stimulant laxatives. Stimulant laxatives are a type of laxative that speed up the bowel movement by stimulating the contraction of intestinal muscles. They have a more rapid onset of action than bulk laxatives and are usually given at night to help reduce a bowel movement the following morning. Now, let's discuss some common examples of stimulant laxatives. Bisacodyl, senna, glycerol, and sodium bicarbonate are all examples of stimulant laxatives. Bisacodyl is commonly used in oral tablets and suppositories, while senna is usually taken orally as a tablet or liquid. Glycerol suppositories are normally used when a bowel movement is needed quickly, with an onset of action of about 15 to 30 minutes. Sodium bicarbonate is often used in combination with magnesium oxide to produce a bowel movement within 6 to 12 hours. Osmotic laxatives draw fluid into the bowel and facilitate bowel movement with bulky and softer stools. Examples include macrogals, saline laxatives such as magnesium hydroxide. In summary, We will see how osmotic laxatives work, their benefits, and some examples of osmotic laxatives. Osmotic laxatives are a type of laxative that draws fluid into the bowel and facilitates bowel movement with bulky and softer stools. This type of laxative is particularly useful for those who suffer from constipation or have difficulty passing stools. One of the main benefits of osmotic laxatives is that they work relatively quickly, typically producing results within 24 to 48 hours. They are also considered safe and effective for most people, with few side effects. Now, let's discuss some examples of osmotic laxatives. One common type is macrogals, which work by increasing the amount of water in the bowel, making stools softer and easier to pass. Another type of osmotic laxative is saline laxatives, such as magnesium hydroxide, which work by drawing water into the bowel and increasing the volume of stool. Stool softeners add moisture to stools and make them softer and easier to pass out of the body. They have added value for patients with hemorrhoids or anal fissures, or for those who is vulnerable in stool straining, is potentially hazardous such as the elderly or those with existing cardiovascular disease. Docusate is one of the examples. We will more discuss about what stool softeners are, their benefits, and some examples of stool softeners such as docusate. What are stool softeners? Stool softeners are medications that add moisture to stools, making them softer and easier to pass out of the body. They work by helping to draw water into the colon, which softens the stool and makes it easier to pass. Benefits of stool softeners. Stool softeners have added value for patients with hemorrhoids or anal fissures, or for those who are vulnerable to stool straining, which is potentially hazardous such as the elderly or those with existing cardiovascular disease. Stool softeners can help prevent straining during bowel movements, which can reduce the risk of damage to the rectum and anal area. They can also help reduce the discomfort associated with constipation. Examples of stool softeners. One of the examples of stool softeners is docusate. Docusate is a medication that helps to soften stools and make them easier to pass. It is available in both oral and rectal formulations and is commonly used for the treatment of constipation and other bowel disorders. Thank you for watching, and we hope you found this information helpful. If you have any questions or comments, please feel free to leave them in the comments section below. Don't forget to like and subscribe for more informative videos.